Gas gangrene is usually caused by the Clostridium infection. It can be seen on scans such as x-rays, and it can also be cultured from the gallbladder bile. For example, if a patient presents with gallbladder issues and they have to have a cholecystectomy, that gallbladder can then be tested for that bacterium. It can also be tested for necrosis as well. Let's see, causes, signs, and symptoms. Gangrene is usually acquired as a secondary disease or infection. It's usually acquired by an untreated bacterial infection and is really susceptible with open wounds combined with the ischemia. And diseases such as like uncontrolled diabetes, atherosclerosis, smoking, renal disease, things of that nature that cause compromised blood flow that can provoke gangrene. And if gangrene becomes infected, it will most likely have a foul odor. With dry gangrene, the signs and symptoms is when the blood supply is cut off, and then that area becomes dry, demonstrates shrinkage, and turns black. The wet and gas gangrene symptoms occur if bacteria has invaded the necrotic tissue, showing signs of swelling and drainage and odor. Other symptoms can include coldness or numbness of the area or extremity, pain, redness, sores that won't heal, fever, blisters, and sometimes even confusion and shock. Diagnosis and treatment. This is kind of sad in a way because a lot of patients that we see end up getting partial amputations of their limbs. That's not the only treatment, but usually diagnosis comes with blood labs that test for white blood cell counts. And if there is an infection, usually can be treated with broad spectrum antibiotics as well as clindamycin, depending on if it's the Clostridium bacteria or not. And tests can be also performed to assess arterial disease, such as CT angiograms, ultrasound Dopplers, and then also x-rays as mentioned previously. The Wi-Fi system was recently created, and it stands for Wound Ischemia Foot Infection. And this just provides a diagnostic guidance for treatment, recommendations such as simple amputations or I guess more severe amputations. Some people start off with just a digit of their toe or their finger, and then sometimes if they amputate the finger off and this part is not healing, they eventually have to cut, further up. Other treatments include hyperbaric oxygen therapy. Sometimes that's with the amputation, sometimes it's without, and sometimes it's with the antibiotics. Let's see. And then prevention. One of the biggest things with prevention with gangrene is catching it early. The sooner you can catch it, the sooner you can prevent the spread, the sooner you can help increase blood flow to the area. And I won't say that it's reversible, but if you can catch it early enough, you can, prevent any further necrotic tissue from forming. And another way to prevent is just to keep a lookout for like wounds or non-healing ulcers, and also if you can prevent, if you can prevent from getting diabetes or renal failure, or keep your arteries nice and clean and clear, that can help a lot as well. All right.